Is suffering from wheezing and episodes of syncope, so we are going to start with respiratory and a cardiovascular exam. So first we're just going to inspect our athlete here. We're going to start by just looking at the level of his shoulders and overall kind of shape and configuration of his chest, seeing if he has any difficulty breathing right now, if he looks like he's struggling. Look for that equal expansion of the lungs. We're just going to start on the anterior side right now, and then we'll have him flip around to the posterior. So yeah, just inspect the skin, any scars, abrasions, discoloration, anything like that. We can look at the fingers for any cyanosis, anything like that, the lips, and then we can move on to some palpation. So I'm just going to put my hands around your chest, and you're just going to take some deep breaths through your mouth. You can breathe in, out, deep breath. There you go. Just feeling and looking for equal expansion of the chest. And we do that same thing on the posterior side. Okay, relax. And then we're going to move on to percussion. So we can do this in a sitting or supine position. I will do it in a sitting. Just put your arms at your side. Cool. Alright, so we're just going to start kind of at the superior chest and work our way down, alternating sides so we can compare. So just relax and breathe normally. And move over. Get that clavicle. Again, just noting any differences in the sound as we go across. Resonance will be the kind of predominant sound in adults. And we want to make sure we get to the sides, especially on that right side, because there's 3 lobes down here. So again, just move our way down. And with the other side. And then, like I said, we'll have him flip around and we'll do the posterior. But right now we'll move on to auscultation, which basically in the same spots, just looking for normal breath sounds. We're going to have him take a deep breath in through his mouth, in and out through your mouth anytime I put the stethoscope on you. Okay, so through this, diaphragm usually picks up higher pitch sounds, which is good for lung and heart. And since this one's only one-sided, that's the one we'll use. But otherwise, the bell picks up low pitch sounds, and that kind of is helpful for abnormal breath sounds. So we're going to look for intensity, pitch, duration, anything like any abnormal, anything like that, as we compare side to side again. All right, deep breath. Listening for any crackles, seeing if we can get that wheezing that our athlete is complaining of as we move down the lungs. Again, want to make sure we get on the sides. Again, lower on that right side with 3 lobes. So now that is full anterior side, so now I'll have you flip around so I can get your legs on that side. And we'll do the same from the back. Again, inspecting the skin, chest symmetry, any deformities, congenital or skeletal. Again, symmetry of the shoulders. And then again, I'm going to put my hands around you. Big deep breath in. Look for equal expansion at the thumbs there. Feel for anything. And I think it's easier to get the rate, rhythm, and quality of the breath sounds and the respiration rates from the back, so we can do that. We'll hold that for 30 seconds. So we did that, and everything seems normal. And then we will do our percussion again and pause. Hello? Jay, you messed up our video.
The hay.
Okie day. Alright, so now we are going to percuss. We'll just move about 10 spots straight down kind of his spine. So we'll start at the top. Again, comparing side to side. Listening for any abnormal sounds or anything different down here. And then we will do about those same spots as we auscultate. So again, nice deep breaths. And again, just comparing as we move down, comparing bilaterally. And last, then we can look for tactile tinnitus by just using that ulnar side of our hand, kind of up at the top of his shoulder blade. Can we just say 99 for me? And check here, say it again. We're just looking for that vibration. Lack of vibration could be an obstruction of some sort, which is possible when our athlete presents with wheezing. And again, we can do that as we auscultate, checking for vocal resonance in those same spots and just saying 99 every time, and checking for differences in the vibration or the sound of the word. Our athlete also presents with syncope. We'll just go right into a cardiovascular exam, which is pretty similar to the respiratory. Again, we want to get a very thorough history, including like duration of the syncope and when it first started and what exacerbates it, anything like that before we even start. Other than that, we can just again inspect the things we did for respiratory, chest, any scars, abrasions, bruising, anything like that, symmetry of the chest. And then we will take all the pulses, presence of the pulse, your brachial pulse here, and then brachioradial, and then your radial pulse. And then we can get a distal pulse down at the tibial down here. Just to make sure, first of all, get rate rhythm equality, and then just make sure there is a pulse in all those spots. Pause. Back up. Good Lord. And then part of that palpation or inspection, we will get a blood pressure. If I had a blood pressure cuff, I would definitely be doing that. And then moving on to percuss. Basically, we've already covered that in the respiratory exam, those same spots. We didn't notice any changes, so we're going to not do that. We'll just move on to auscultation, which there are 5 major spots, and we're going to listen to the breath sounds, just the beating of the heart in general. On the right side in that second intercostal space next to the sternal border, just have him breathe normally. Listen, and then we'll move over to the right side, listening to the valves open and close, and move down to the third. And the fourth. And then the fifth, which is that apex of the heart, such that you can hear max hearing. I'm not in the right spot. Again, call. I can hear it. Second. Come on. Here. All right. Anywho, okay, and our fifth, so we've noted any abnormalities or anything like that, and then we'll have him flip around again, and we'll do the same thing. Again, we'll start on that right side. Looking up. presenting with abdominal pain that they've been suffering for several weeks, so we will move into an abdominal exam. We're gonna have our patient supine. Ideally, we like the knees bent at about 90 degrees. Our couch is too short for that, and my brother injured his knee and is not allowed to flex that far. So straight legs it is for us. So again, we're just gonna start with some inspection. Just look at kind of the overall movement of the belly as he breathes. Any scars indicating any previous surgeries, bruising, skin color that's abnormal, anything like that. You can feel temperature, any differences. And then for abdominal exams, we auscultate first. So we're going to listen to each of the 4 quadrants, look for the presence of vowel sounds, or anything abnormal would be, any abnormal things, water rushing, high-pitched sounds, or just absence. Vowel sounds aren't considered absent until you've listened continuously for 5 minutes. So we'll just start in that right upper quadrant, and just so you can breathe normally. And then once we hear vowel sounds are present, we can move to the left upper quadrant. And then the left lower. And the right lower. We're going to move on to percussion, and it's about 3 spots per each quadrant. So we'll start with that right upper quadrant, and we can listen for changes in hollow or solid organs, as well as just air. Moving down to that left lower, and the right lower. And then we can also check the size of the liver, which is on that right side. So we can start by kind of up in the chest, listen to when we hear that change right about here, and then work our way from the bottom, and listen to that same change about there. So we can kind of estimate the size of the liver. We can even get it going back on this side. We will palpate, so we'll just start with light pressure, just using the pads of our fingers in each of the 4 quadrants before we move to kind of harder pressure. Just want to make sure that things are right, kind of roll up. We know if there's any pain or tenderness. Nice and light. And then if everything feels all right there, then we can move to a little bit harder pressure. Kind of trying to get past the muscles, more into the organs and other soft tissue. As he just breathes normally, and if that is all right, then we can move into palpating the liver and the spleen. So first, the liver is kind of at that base of the rib cage with the fingers pointing upward. It's gonna be hard from this angle, but kind of wrap around the back. There you go. Okay, relax. And then just go ahead and take a deep breath. You can kind of squish the liver in between your fingers and see if that's painful at all. And then same thing for the spleen, but on the other side. Okay, relax. You push up more with your bottom hand and kind of push the spleen into the top hand. As they breathe, and you can feel it right in there. Any pain there? Okay, so because our softball player is presenting with some throwing arm weakness, we're going to rule out any nerve issues by doing a quick neuro exam. So first, just going to check muscular strength. So go ahead and shrug your shoulders. Don't let it push you down. Okay, arms out to the side. Don't let it push you down. Curl. And push down my hands. Okay, spread your fingers. So let me squeeze them. Squeeze my fingers. Good. Squeeze my hands. Gently. And then go ahead and curl your wrists and your fingers. Don't let me pull you up. Okay, so now we're just going to test the sensory components of those nerves. So just tell me if they feel the same on each side, okay? Does this feel the same as that? Does this feel the same as that? Does this feel the same as that? Keep your arm like this. And back. That feel the same as that? That and that? And that and that. Good. Okay, then we'll just check the reflexes really quick. So we'll start with the biceps. So just go ahead and just relax. You just hit your thumb and you should be able to feel that tendon jump. And we'll do brachioradialis here, so just find the tendon right about here. And you can kind of have to squeeze their hands so you can feel them grip or tense a little bit. Feel that? Feel that one? Right in there. Then we'll do tricep. So you sit sideways, kind of. There you go. Okay, so I'm just gonna bring your arm back, sit up straight, and relax, relax. So again, find that tricep tendon right in there, and try to get a good response. And there it goes. We're just gonna do a lower quarter neuroscreen just to be thorough. So go ahead and lift this knee off the ground. Don't let it push you down. Good. Relax. Kick out. And push it in. And kick in. Good. And toes up to your nose. And hold there. And push your toes down. My hand. Push, push, push. Good. And then bring your big toe up to your knee. There you go. Don't let it push you down. Good. And then we would check bilateral, of course. I'm not going to do it on him because he has a hurt knee. And then we're just going to do the sensory things again. So move your hands. Just inside so I get to your legs. Okay, that feels the same as that. That feels the same as that. That feels the same as that. Same. 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 And over here, same. Good. Okay, and then we'll just do patellar reflex. It's going to be hard because our couch isn't tall enough because you'd want the foot off the ground. So I'm going to see if I can get my hand in here and just relax. Find that tendon, see if we can get him to hop. It's going to be hard. There you go. And then we do Achilles. Again, it's going to be hard because our thing is too low, so we're going to just relax. But realistically, you have him just hanging off here and then hitting that Achilles, and you can feel him pump down in your hand. Yeah, I think we'll just... Wrapping up the neuro exam, we're going to check the cranial nerves really quick. So I'd have him smell something, usually an alcohol swab, see if he can smell that. And then have him read an eye chart kind of on the opposite wall, see if the lowest line he could read. We'll check the reflex, the pupillary reflex to light, so go ahead and close your eyes. And then on a count of 3, open and look at my voice. 1, 2, 3. And just compare pupils there, that looks good. And then we'll have you clench your jaw. Don't let me open it. Good. Okay, and then go ahead and follow the pen with just your eyes. Just make sure we check all directions. Good. And then we'll check facial feeling. That feels the same as that. That feels the same as that. That feels the same as that. And that feels the same as that. Good. And then we can check hearing. Which side is it snapping on? Good. You smile and frown. And then swallow. Or have him taste something so you can watch him, make sure you can swallow there. Open your mouth, say ah. Stick your tongue out, wiggle around. Then last thing, we'll just check his peripheral vision. So let me know when you can see this finger over here. Okay. Okay. And this side. Okay. And then we check his balance if necessary, but we're not too worried about any head injury, so we're going to skip that part. And wrapping up our final exam, our athlete does present with tinnitus, so we're going to do a quick head, ear, eye, nose, and throat exam. So we'll start with just palpating the head. Just sit straight. Let me know. Let me know if anything is sore. Just do all the bones of the skull. Come down to the facial bones, the zygomatic arch, above his eyes, down his nose, his jaw, all the way back. You can check his cervical spine for any tenderness. And then we will move on to looking in the ears. So first we're just going to look at the overall shape, see if there's any battle signs, anything like that. Check for CSF leakage. Otherwise we'll take our tool, which I don't have, but I will pretend. And we want to pull the ear kind of up and back so we can straighten out that ear canal. And just look in, and we do that on the other side. And then we will look at the eye. So we've already looked at pupillary response and the eye charts and tracking with our neuro exam. So we can just go right into looking in the eye again with the tool that I don't have. But we're going to go my right eye to his right eye so it doesn't look like I'm kissing him. So just go ahead and look straight, kind of past my ear. I look in. And then again, do the other side. And then moving on to nose, again, you want to see if there's any CSF leakage, if it looks obviously bruised or broken. But same thing, just take our tool and look up, and again on the other side. And then last, we'll just kind of palpate his throat, so just have him open his mouth, see if there's anything in there, any broken teeth, anything like that. Then close. And then I'm going to have you turn that way, sideways. So when palpating the throat, you want to come around from the back so it doesn't feel like you're choking the patient and have them get all freaked out. So just come around. Feel pyoid bone. Will you swallow for me? Good. You can feel thyroid cartilage, cricoid cartilage all the way back. See if there's anything painful or tender there. Any deformities. Make sure his throat is in a line. There's no deviation. And then you turn back. We'll just make sure we get palpating lymph nodes, see if they're swollen at all the way down his neck, between his collarbone. And you shouldn't feel anything if they're not swollen.